So you will have noticed that for a lot of abnormal lesions on the cervix, the management is colposcopy. So what exactly happens at colposcopy? Well, colpo means vagina, so it just means visualizing the cervix through the vagina under magnification. It requires extensive training to be able to identify which parts of the cervix are normal and which are not. And doctors use acetic acid to help them to do this. It's a diagnostic procedure and it can be a therapeutic procedure. Some of the diagnostic questions that will be answered during colposcopy are: is there any squamous intraepithelial lesion present? What is the extent of the lesion? And is there any microinvasion? Then there are certain criteria that need to be met in order to actually treat the lesion that's being seen. And I use the memory aid PEMEC to remember what those diagnostic criteria are. So the P is for parity. Is there parity between the different results? So does the cytology, probably pap smear, the colposcopy, and the biopsy results, if there is a biopsy, do they all agree? So if you're seeing L-cell only during the colposcopy, but on biopsy it showed microinvasion, then you cannot go ahead with therapeutic intervention with colposcopy. The E is for extent. Can you completely visualize the abnormal area? The M is for microinvasion. There must be no microinvasion. The E is for endocervix. So the endocervical canal needs to be normal. So that means there must be no abnormal glandular cells on pap smear. And colposcopy must be available. If you don't have colposcopy, then of course you cannot use any therapy during colposcopy. That might sound silly, but there are lots of places in the country where colposcopy isn't available, and in those cases you will not be able to treat during colposcopy. You'll have to go straight ahead to a cone biopsy. So what is the therapy that is used during colposcopy? It's called LETS, and that stands for large loop excision of the transformation zone. And you'll see a picture of this later. You ensure complete excision of the transformation zone. You take about 7 to 10 millimeters of tissue, so it's not a huge procedure, and this is just done in a normal hospital room. It doesn't need to be done in theatre. And these patients who have had LETS need to be followed up for at least 5 years after the procedure, but 10 years is better. So if you can follow them up for 10 years, that's better. If these criteria are not met, then the patient needs a further diagnostic procedure, and that is a cone biopsy. Cone biopsies need to be done in theatre preferably, because quite a large volume of tissue is taken out. 2.5 centimeters of tissue is taken out during the cone biopsy. Cone biopsies are a diagnostic procedure, and it's basically to help you decide if the patient needs a hysterectomy or not.